So welcome. I know there's more people turning up. There's a few people live, but I know that there's going to be a lot of people watching this on recording. Welcome to this monthly meetup that we're having for the Integrative Health Professionals Medicine Group. We have Glen Davies with us tonight. He is a GP that works in Taupo, and he has established Reversal, which is a lifestyle-based approach to reversing type 2 diabetes, and I understand it's been very successful. I also understand that Glen's been working with some mental health and lifestyle management, so I'm very, very keen to hear about that. So welcome everybody, and yeah, Glen, the floor's open. We'd love to have some discussion probably afterwards, but the floor's open for you to let us know. I'm really passionate and really want to understand about how you got into actually doing this, and I'm also keen to understand what the response has been from mainstream medical too about what you're doing.
All right, so thank you very much, Helen. So I guess the longer story is I first listened to Grant Schofield speaking at one of the general practice conferences about 8 years ago, and in his talk he said that type 2 diabetes is reversible, and that was the first time that I had ever heard that in my entire career, and I went, well, this is unusual and sounding a bit crazy. And then the lecture immediately after that was a bariatric surgeon who said type 2 diabetes is reversible, and so I heard it, one after another, and I went, oh well, there's something in. And then around the same time the direct trial had come out. I think it came out in December 2017, and that was using an 850 calorie a day diet, usually I think it was mainly OptiFast, and in that trial 46% of the people in the 850 calorie group reversed their diabetes, and so I'd heard three completely different methods, all of which were able to reverse diabetes. And so that got me really interested. And I concluded that bariatric surgery is not going to be the ideal option for the majority of people, that a 850 calorie a day diet is not going to be sustainable. So, Grant's talk was the one that really captured me. And then around the same time, a patient called Wayne, who turns out to have an IQ of around 160, he came into my room. He told me I was bloody useless. It was about time I read something, and he put 6 books on my desk. So one of them was What the Fat by Grant Schofield and Karen Zinn, and another one was The Diabetes Code by Jason Fung, and those 2 books particularly really convinced me that a carbohydrate restricted diet was the way to reverse diabetes. And Wayne and myself and some others, we sort of formed a peer group, and then some clients joined the peer group, and that sort of launched Reverse Type 2 Diabetes Taupo, which now has 4.4 thousand members. And I know of 200 people that have reversed their diabetes, which means they've gone from the diabetic range into the pre-diabetic range off all medicines except for metformin, or they've gone from the pre-diabetic range into the normal range, and they're still allowed to be on metformin. But I suspect there's probably, close to 2,000 people. I can only talk about the ones that I have recorded the data, but my sort of intuitive feel is that through through the Reverse Type 2 Diabetes group, and all the work that Karen and Grant have done, and the work that all the health coaches are doing, I would suspect I've probably interacted with around 2,000 people. I think one of the things we need to do next at Whole NZ is we need to set up a national database where anyone who's reversed their diabetes, or as a health coach or a nurse or a doctor who's done that. We need to be able to record that, similar to the sort of the VAERS recording system, so that we're actually recording the data, because it's the data that sways um, the funders or the Ministry of Health in the end. So that's a
Amazing.
project for soon. But as happens, I guess, to all of us, we realize that we're not just talking about type 2 diabetes, we're talking about insulin resistance, and insulin resistance is Alzheimer's disease and hypertension and cancer and ischemic heart disease and mental health. And so, the interest then moves from type 2 diabetes to all these other conditions. And at Reversal, our main programs that we're running is the metabolic health program, largely around type 2 diabetes. Interestingly, weight loss has not been a major part of what we've done, which surprises me. And then, interestingly, a complementary approach to cancer is probably the biggest program that we were involved in, and there's probably, I think we're supporting 80 to 100 people with a complementary approach to cancer. And then the other program's been the mental health program, and I think the most success we've seen has been in young men, where I think there's a huge need. So um, in our cancer program, we've got an oncologist, we've got cancer coaches, we've got coaches and nutritionists, and in the mental health area, we've got a health improvement practitioner and coaches. So what I was going to talk about was specifically our mental health program. I hope this isn't too basic for people. You will know all of this, but what might be of interest is just how we've combined the modalities into one quite sharp program. So I'll screen share with you, and I'll go briefly through this PowerPoint. So is that PowerPoint coming up for you?
It is. Yep,
And
it is.
just tell me that the slides. Just need the slides to change.
We've got the entire sort of screen up though. We've got all the.
Yeah. I'll leave it like that if you're happy with that. I can turn it into a slideshow.
It's a little bit little otherwise. Oh, that's better.
All right. So this is our mental well-being program. So our modern life is very different from the way that we have lived in the past, and that saying that we use all the time, that our genes are 2,000 years old, but most of our environment is 50 years old, and so there's a dramatic mismatch between our genetics and our modern way of life, and we're seeing that particularly with the ultra processed food. So the two gentlemen sitting around the fire, I expect they look like they've just eaten a fish that they've caught, and they're probably drinking some form of tea or broth. They're talking to each other, and they're sitting outside. They're squatting, which is I think generally the way that traditional people sit. They're not sitting in a chair. Dramatically contrasting with, I assume that's the underground in Tokyo. And that's a fascinating slide. I'm not sure if that is just someone clicking a picture or if that's acted, but every single person is on their phone, and not one single person is talking to each other. Um, I'm not sure. It looks like it's been acted, but it may not be. So
I,
our
I don't
modern
think
life
it will be,
is,
Glenn. I used to use the train all the time, and that's what it looks like.
yeah. So it's a very different environment, and this whole concept of technopathology, you know, the smartphones sort of, I think, since around 2010. So this is very, very new, and the impact on neurotransmitters, I think, is only just starting to be explored. So what impact this will have, I think we've got some intuitive idea, but I don't think there's much science, yet talking about the dramatic impact that that change must have. We were thinking about, I do a program on RCR radio, and I was talking to Paul Brennan, and he was saying, if in 100 years you were lecturing on the most important events in the history of the world. So I think one of them would have been when the mitochondria first got taken up by a cell and they decided to have a symbiotic relationship. That would have been a significant event. I think the first time photosynthesis occurred would have been a very significant event. I think the day the internet first was invented would have been significant. And I can remember at Tauranga Hospital, we all got called up to the medical library. It would have been in 1995, and they said, we're going to demonstrate the internet. And I hadn't heard of the internet. And we all stood around for 20 minutes and listened to this dial tone, and nothing happened. And I said to my mate, I said, well, that's not going anywhere, is it? So I got that wrong. And then, the next one must be the the smartphone. So there's probably been some other quite significant events in that 350 billion year history, but they'd be four of the ones that I'd pick out. That's just another example of life being significantly different and significantly simpler, possibly 100 years ago in New Zealand. This is Jeff. He's very happy for me to talk publicly about his history. He's a relative. He lives in Mokau, close to New Plymouth, and he's had a lifelong struggle with mental health issues, and probably hasn't been able to work consistently for a large part of his life. There's a few clues in this picture that I'll expand on later. One of the clues around his neck, the other's the number plate on his boat, and the other's all the buoys out behind him. So we'll come back to Jeff as we run through the slideshow. So let's start talking about neurotransmitters. That apparently is the chemical structure of glutamate. It was Grant Schofield that introduced me to this topic, standing on the side of the Blue Lake in Rotorua, watching a triathlon in a huge group of people, and Grant, in his huge voice, as he always did, called out to me, and he said, "Come here, I got to talk to you about glutamate." So he started in his big voice in the middle of several hundred people giving me a lecture about glutamate as we watched the swim part of a triathlon. So that was where I first learnt about glutamate, and I would say that the glutamate hypothesis has probably replaced the serotonin hypothesis as the dominant explanation for mental health challenges. The idea is that glutamate is triggered by trauma, and then its levels are high related to stimulation of the sympathetic nervous system. And glutamate is a neurotoxin. Glutamate is balanced by GABA, and GABA is the parasympathetic side of this equation. So yin and yang stuff. Most people in the mental health challenges are probably suffering from chronic stress, have probably had trauma in their past, and probably have high levels of this neurotoxin called glutamate. The reason I say that I think the serotonin hypothesis is dead is that we've seen an extremely disappointing response to the SSRIs, which are pushing up serotonin or preventing the reuptake of serotonin. So I think it's time that we challenged the serotonin hypothesis, and I think the glutamate hypothesis is an excellent challenger. And most of what we're talking about in this kōrero is going to be based around the glutamate hypothesis. So this is our program. Step number one is nutrition, and it would largely be promoting a carbohydrate restricted, but not necessarily a ketogenic diet, with a Mediterranean flavor, emphasizing that sugar is a neurotoxin in itself, that it causes brain inflammation, and it inappropriately promotes high levels of dopamine. Avoiding vegetable oils or polyunsaturated vegetable oils, which are also neuroinflammatory. So I think those two steps alone will probably create significant improvement in most people's mental health. Eat above ground vegetables. The point there is we're trying to reduce the carbohydrate intake. Cook from scratch, because any ultra processed food will contain sugar and unhealthy vegetable oils, because they will use the cheapest ingredients. And then think about fiber from the above ground vegetables in particular to support the microbiome. And then our coaches will, of course, find what aspect of that type of diet will work for people, recognizing that probably all of us in this group have the privilege of being able to choose to eat healthy if we choose to, but many people in society don't have that choice. So acknowledging that it is a privilege to be able to eat food like is what in that slide, and not everyone has that privilege. So number one, healthy nutrition. When I'm talking with whānau, I like to use the term kai Māori, and I ask what did pre-European Māori eat? And if you think about it, it was a ketogenic diet. It was kai moana. It was birds. I often joke that they ate a few too many of the moa, a bit too quickly. And then there were above ground vegetables. There was the fern root, which is interesting. It had to be pulverized to get sort of the starch out of it. And then kumara, my understanding of the history of kumara was that it was difficult to grow, and it was quite small until about 1860, until new varieties were introduced. So, and I'm very happy to be corrected, but I think the kumara was largely used as a ceremonial food and not an everyday food. So I think it was definitely a low carbohydrate diet that avoided polyunsaturated vegetable oils. It avoided sugar. It was low in carbohydrate. And of course, there was a lot of effort involved in obtaining the food. Now, supplements. So this leads into Julia Rutledge's work, which I'm sure you'll all be familiar with, around the concept of using appropriate high-dose nutrients to stimulate neurotransmitter production. She doesn't talk about the actual supplement that she uses in her research, but it's daily essential nutrients that comes out of Canada. It's an expensive supplement, so the big bottle, which gives about a month's supply, is around $250 retail. So it's not a cheap supplement. What's different about daily essential nutrients is that using very, very high doses, so the fat soluble vitamins have been reduced so that you don't get toxicity, leaving high levels of the water soluble ones. My simplistic explanation is that there's probably blocks in the production of the neurotransmitters. So you try and force more raw material in through the funnel, and hopefully enough gets through to produce normal levels of neurotransmitters. And then there'll be the detoxification aspects of it as well. But my impression of daily essential nutrients is that it's a highly effective treatment if it's used in combination with these other modalities. It's expensive, so not accessible by everyone. I had to do I think it was a 3-hour training course to be able to prescribe daily essential nutrients, whereas I can prescribe chemotherapy with no training whatsoever, which I find ironic. And one of the big parts of that training is around this idea of nutrient pharmaceutical interaction, and quite an unusual way of down titrating the medicines, where you push up the dose of the daily essential nutrients until you get a side effect, and then you lower the medication. It's I've never done that with any of my other deprescribing, but I guess it's around safety, working on the assumption that the medication is having some effect, and so that you're wanting to cross over without getting that period where people are without treatment. So that is the daily essential nutrients. Next one is exercise. I've heard that exercise is 2.5 times more effective than SSRIs in mild to moderate anxiety and depression. There's a whole lot of science around which is the best form of exercise. Is HIIT training better than going for walks? Is it resistance training? My attitude to that is that it's what the person enjoys doing, what the person can sustain, and what is practical for them. I suspect that the HIIT training is probably the ideal, but I think it's far more important that it's what people enjoy and what's sustainable for them. Yeah, so introducing exercise is an important part of it, and I find the young men accept that quite easily. Even when they're quite low in mood, they seem to be able to accept the exercise and seem to enjoy going to the gym. Whoops. Now sleep's an important component, and that's a whole lecture in itself, of course. But taking a decent history, and the big things that I pick up is the blue light prior to bed, and the importance of the blue blocker sunglasses if people do use their screens before they go to bed, not putting the phone in the bedroom, buying an alarm clock so you don't have to depend on your phone. Interesting science just showing that even having your phone on your desk, even if it's turned upside down and you can't hear any of your notifications, still affects concentration. Yeah, so affects sleep. And one of the big points about sleep is when you are asleep, you increase the glymphatic channels. So the lymphatic system of the brain, you increase its volume by about 4 times. So you're increasing the flow of CSF around the brain, which is literally brain washing. It's removing some of the proteins which build up, and we know about these proteins in Alzheimer's and in Parkinson's disease, but I suspect that this buildup of proteins that we don't need is probably going to turn out to be an issue in a whole lot of these chronic conditions. There's a whole lot more to say about sleep, of course, but that's where the coaches take over, and being on the client's agenda, working out with them what needs to be the priority at that time. Now, this aspect I think is really worth dwelling on, because what I have found fascinating is that the young people, they are all over cold water immersion. Many of them have done it, many of them are doing it. When I bring it up to older people, they don't know about it. All the young people follow Wim Hof. So it's not difficult to convince them to add some cold water immersion. And I'm surprised how easily the young people just say, "Yep, yeah, I'll do the cold shower. How long do I need to do it for?" Many of them will do the cold swims. Um, the science of it, it's probably about a minute per degree. So if you're doing an ice bath, so you've got a freezer, you've frozen the top of it, you've got close to freezing water underneath, you smash the ice on the top with a hammer and then you get into it. That's probably about a minute. And then if you're in Lake Taupo around this time of year, it's probably somewhere between 10 and 12 degrees. So, you're building up to 10 minutes, but it is a significant treatment. It does have side effects. It can cause migraine. I've seen someone who almost sort of had close to a stroke type syndrome after, doing it too much too soon. So I think you have to be a little bit careful with it, build it up. I don't think that's necessarily the case with cold water immersion, but spending time in Lake Taupo this time of year, I think you have to be a bit careful. And an issue of whether you put your head under or not, I think you need to build this up. And I certainly wouldn't be going straight into 10 minutes of cold water immersion. But it's not just cold. So sauna, particularly infrared sauna, has a big role. The whole idea here is that our stress response is based around saber-toothed tigers. It's walking out of the cave. There's a saber-toothed tiger there. Whatever outcome, it's all over in 30 seconds, isn't it? Either you ran away, you killed the tiger, or it ate you. But that's not chronic stress. It's all over very, very quickly. So we're trying to reproduce that short, sharp stress. I talk to people about it's like rebooting the computer. I think what you're doing is you're rebalancing your sympathetic and parasympathetic nervous system. You're hopefully you're causing a sharp increase in sympathetic tone, and then it comes back down to lower than where it usually sits with chronic stress. So that's cold water immersion or sauna, or whatever sort of unpleasant short, sharp stress you want to give to yourself. And now we're back to Jeff. So this is Mokau Beach. Jeff has been so successful with this program that other people have started following him. So think of that sort of Forrest Gump scene of the Forrest running past and the young guy coming out of the university and saying, "Hey man, I like what you do," and then other people have joined him and they haven't missed a day. And it's referred to as the Mokau Dippers and or Jeff's harem, but they don't miss a day. So back to Jeff's story, he's now there's been a really significant improvement in his mental health. He's working full time. He's happy, vibrant, excited. It's really made a big difference. He's still on medications as well. So this is complementary therapy. This is adding these lifestyle interventions to medications, and he continues to do extremely well. I'm just not sure what the next slide. So Jeff's Jeff is a master snapper hunter, and he's often on the cover of fishing magazines because he wins all sorts of competitions. And what he does, he's got that tiny little boat that you saw. He can go out, launch off the beach, and go out when other people don't. He fishes in close, and people with their $1 million launches go out past him, for an hour. come back in and see all the fish that he's caught. So that's Jeff's story. The other part, the yin and yang of the sympathetic and parasympathetic side, is to push up the parasympathetic. So anything that causes calmness, and of course there's so many options, and our coaches talk to people about what one's going to work for them. So whether that's mindfulness or meditation or deep breathing or yoga, etc., etc. Walking on the beach, negative ions coming off the sea, grounding, so walking barefoot, spending time with nature, spending time walking in a forest, whatever aspect of this works for the client. Then the idea of community, and I'm sure that everyone's familiar with ACT and the fact that people's life gets smaller as their mental health deteriorates, and encouraging people to expand rather than contract, and to rebuild some of the relationships that they have often let go as they become more anxious or more depressed. So encouraging people to reform those relationships in whatever form that might take. Sorry. I'm using my mouse to change the slides because they're not changing with the keys. And then addictions, and I think we need to have a much wider concept of addiction, where we always will think of drugs, alcohol, gambling, and sex addiction. But I think this modern addiction to the smartphone is really something that needs to be looked at. Doom scrolling was a word that I only heard for the first time a couple of weeks ago. But that seems to be a significant problem. The distraction that occurs from just watching memes all day. I think we really need to be asking people, are they comfortable with the amount of time they're spending on a screen? Food addiction, carbohydrate addiction is massive. I think when in type 2 diabetes, I can't remember the exact fact, but I think it's about a half of people with type 2 diabetes have a food addiction. We're not asking about people's relationship to food. We're just assuming that they can make these changes. I think it's important that one, we give the information, but two, we use our health coaches' questions to make sure that people can actually make these changes. And then television, television's changed so dramatically, isn't it? You used to, there'd be a program you wanted to watch and you'd watch it. Now you can choose whatever you want to watch at any time. So television is far more addictive than it used to be. But, we don't think about work as an addiction. And I think as health professionals, we have to think about that. We have to think about our people-pleasing personality. Are we addicted to pleasing others, pleasing our boss, helping people? This concept of addiction has to be, I think, expanded. And, as coaches, I'm sure we do this, but I think as in standard medicine, we don't think of the term widely enough, and it's huge negative impact. And I think probably as older people, we may not appreciate the power of social media, maybe even in that younger teenage generation, and the online bullying stuff, and maybe the more subtle aspects of that. And then bringing it all together. So we're all time constrained. So going for a walk with a friend, that's bringing together exercise, vitamin D from the sun, time in nature, and whānau. Swimming on a sunny day, you've got your cold water immersion, your vitamin D, and the exercise. And the last one there is a little bit tongue in cheek, preparing a meal with the grandchildren. That's a exercise in deep breathing. because that may not be good for your parasympathetic tone necessarily. But and then that's the slide I was looking for. So Jeff is a slayer of huge snapper, which also gives him a whole lot of joy as well. And then the second part of this, of course, is the talk therapies, and whether you're using cognitive behavioral therapy, whether you're using ACT, whether you're using FACT, or whether you're using coaching, they're all methods of talk therapy, which is the second half of this. So that basically is our program. We developed this. We were approached by a Maori trust in Taupo who funded some of their members to go through this program. So that's still underway, and we'll report on that first cohort. And this followed on after we did a similar program on type 2 diabetes with this trust. And I'm really excited to be working with the trust because it creates the opportunity for Maori to have the same access to private healthcare as people who have private health insurance. And I'd love one day to be giving a lecture like this and talk about Maori having greater access to healthcare because of trusts prioritizing and funding health. So that's enough from me.
That was fantastic. Thank you, Glenn. I have a number of questions. You answered one of them about how you were being funded for this. So that's that answer. So your clients are also coming through via the trust, or where are you getting your clients from? Are they from GPs or?
No. So Reversal NZ is a private, like a fully private general practice. And I was giving a lecture last year at the Christchurch GP conference, and someone said, well, I'm not going to listen to you because you don't live in the real world. You have motivated clients, you have half an hour to an hour with people. They've paid a big fee, so they're clearly motivated. This isn't going to work in the real world. And I kind of went, fair criticism. So for that reason and others, we've purchased a rural general practice in a town close to Taupo. And part of the challenge is these metabolic health programs and the mental health program. How well does it go in a very low cost access general practice? So the metabolic program absolutely working fine. I haven't had an opportunity to experiment very much with well, it's not true because not sort of the full program, but in that 15-minute consult, I would pick one of those aspects and with a coach approach challenge someone. So this week I've said to someone, have you heard about cold water immersion? And they went, yeah, and are you doing it? And they went, nah. I said, well, would it be something you'd consider? Yeah, so yeah, just pulling aspects of it, but I haven't tried the full program. It just doesn't fit easily into 15 minutes, does it?
No, it doesn't. Are you doing group work? Because I think that's something that is being talked about a bit too, like just getting groups together, giving them the information. Is it possible?
So we certainly will be. We're just really early days, but the shared medical appointment, I think, is, an excellent opportunity in any area. Like, you kind of picture it working well in the diabetes realm, but it works equally well with mental health, with any other aspect. I've done quite a lot of work with shared medical appointments when I was at the Taupo Medical Centre, but just haven't introduced it yet.
So are you full time now in Mangakino?
So at the moment I'm working 4 days there and 1 day at Reversal. And then from the 10th of October, it'll be 2 days at Reversal and 3 days in Mangakino.
Right.
Very, The whole idea is that one day I'm going to write a really long essay comparing and contrasting these two different styles.
Yeah.
And both have quite significant value. And how can you introduce health coaching and metabolic medicine or lifestyle medicine into a general practice with the time constraints and the funding constraints? So I haven't answered all those questions yet. I certainly know that in this private model or private general practice model, all these programs are working really well, but transitioning them into general practice is the challenge.
Mm, mm. Yeah. And health coaches, are they part of the Mangakino practice as well at the moment, or?
Yeah, so my wife Vanessa's, who is the practice nurse, is also a pre-cure trained health coach. So Um, I just take people next door, warm handover. Can you talk to this person about a carbohydrate restricted diet or their smoking or their exercise?
Mm,
So the GP health coach model, I think, is the key to doing this in general practice because it's usually not what they've come in about. So you've dealt with their problem and then you've brought up a nutrition issue. You can't then spend half an hour, educating people about what that diet looks like. So being able to do the warm handover to a coach
mm,
in your practice who who is willing to, not all practice nurses would accept that, because they'll go, well, I'm busy. But Vanessa will say, yeah, yeah, sure. And you have all the resources available and you go, well, look, I've only got 2 minutes, but take this away and read it and come back. You have to have your strategies.
mm. God, I think you're doing amazing work. One more question and then I'll open to others. I was really interested to see. Oh, we have had Julia speak actually to this group, so we know of Julia well. And one of the things I was interested in is that there's an addition of St. John's wort in those supplements. Is that for everyone, or is there much concern about medication interactions with St. John's wort?
Um, I I think it's the coach approach again, like offering people alternatives and that's you know, uh, often, particularly in the reversal world, people are far more comfortable taking a herbal treatment or a supplement than they are taking a medication. And I think, yeah, I think there's definitely a role for SSRIs or a role for St. John's wort, and it's again what the person wants.
Mm.
Um, yeah.
Fantastic. Has anybody else got any questions? Because I'll just hog Glen for the rest of the evening otherwise. Anyone
Yes, I
else?
do.
Yes.
Thanks, Glenn. That was a great program. My question was around addictions because one of the major breakthrough that I found in my coaching with my clients. So I've got like a 70-plus-year-old woman who never knew anything about carbohydrate until she came to me. And what we found out in our coaching sessions maybe 2 weeks ago was the addiction to sugar. But that was something that related to trauma, past trauma. How do you talk to somebody with that, with food addiction because of past traumas, if that makes sense?
Um, yeah. That's a great question. That's why I have health coaches trained in food addiction because it's a really difficult conversation, isn't it? My, I might throw that back at you because you're probably better at answering that question to me. For me, I'm asking the questions, I'm identifying the issue, but I do pass that on. So you might be a better able to answer it than I am. How do you do it?
Yeah, I'm just thinking, would I focus more on the addiction part or the trauma part? Because I know with coaches, like scope of practice, we're not therapists, we're coaches. but that's where I find a little bit struggle with, because yeah, like it's quite interesting
Yeah,
I
and
I
difficult
guess,
at the same time.
yeah, I guess
yeah.
acknowledging, acknowledging that it is addiction, and people beat themselves up about not being able to not have that treat after dinner, and I think acknowledging it's a big part, isn't it, and recognizing that it is hard. There might be other people who are far more skilled in coaching food addiction than I am.
Thanks, you.
I often get people to do a food mood diary and just to start writing it down and making those associations. So what did I eat? How was I feeling? And even just making those associations sometimes is enough for someone to go, oh, I notice that every time I'm angry, sad, pissed off, whatever it might be, that I binge on whatever. So even just for them to start identifying that, I think is a huge step.
Yeah, yeah. It's, what I've because we talk about all that. It's just interesting working with like a elderly person, because I see
Mm,
that there's something they don't want to go there.
mm. Yeah, it's tough. It's tough, and maybe they do need more, access to a therapist to discuss that more. But I think acknowledging it and understanding what their triggers are is super important and is a good
Mm,
start. Mm. Thank you.
thanks.
Any other questions, Glenn?
I've got another question. Sorry, 'cause my
Yes, no,
mind's
go.
going. Um, I'm going for a walk with one of the mental health leader in the community, Pacifica community, tomorrow morning, and he often talk about health is there's no health without mental health. So I'm thinking, what comes first? Is your health or your mental health?
Well, that's a great question. Um, yeah, I guess you can't separate them. That the desire to compartmentalize and reduce is sort of like a Western medicine concept, isn't it? Whereas if you use a more holistic model of health, you would probably just acknowledge that they're so closely interrelated that you couldn't separate them. Um, sorry, something just came to mind before that I wanted to mention is we do have the ability to measure neurotransmitters, and I find it quite bizarre that in every other aspect of medicine we test first. I can't imagine that you would treat someone's low iron without doing an iron test, or treat their hyperthyroidism without checking their thyroid first. Why do we not check neurotransmitters in mental health? And we do have access to that test. Of course, they're expensive, but through there's two functional labs in the Hawke's Bay. So there's FX Med and NutraScript. Both of them offer neurotransmitter tests. I've found them really, really useful. And I've working in this private environment, I'm quite privileged because some people are quite wealthy and they're happy to repeat the test after you've made an intervention, and then they do the neurotransmitters again. I'd never had that privilege before, but really interesting to see the way that serotonin and dopamine and GABA all change in response to this interventions like this. And what an amazing form of biofeedback it is when people they say, I feel less stressed, and then they can see that reflected in the neurotransmitters. So although they're really expensive tests, I mean, I don't push people, but if it's within their something they can afford, then those integrative tests are quite amazing. And then the other one that is really useful is the microbiome testing as well, which is integrated into this as well, but perhaps not quite as easily relatable. But yeah, sometimes when I'm not getting anywhere, I might do the microbiome test, and sometimes I find the answer there. Sorry, I went off topic, Talisa, but I
Is
guess
this
it
the
is related.
glutamate test as well?
Yeah, so it measures glutamate and GABA and serotonin and dopamine, and then some of the stress hormones, so the adrenaline and noradrenaline, and then there's glycine and a few others. I guess I'm only really looking at the glutamine and the GABA, the serotonin and the dopamine, but this whole idea of dopaminemia and then dopamine resistance. I think with when you look at the huge surge that occurs with gaming in young men, games such as Fortnite create this massive surge in dopamine, and the other one that's doing this is pornography. So those two things that are particularly affecting young men, creating these massive surges in dopamine, you then become dopamine resistant. And so having a meal with your family just doesn't give a buzz at all. Playing sport no longer gives a buzz. And I don't think we're really fully understanding this. Um, one person who's repeated the test was a professional athlete, so again, that's this massive levels of dopamine. You get used to that. Imagine, I mean, I haven't experienced this, but having a whole stadium of people or a whole auditorium of people just watching you must be the massive dopamine surge. So is watching Coronation Street in your retirement going to do it for you? Absolutely not. So, this concept of dopamine is really important, I think.
So interesting. And how long is this? So you're doing this in the private practice, and so how long is this going to go? Is this you just going to continue doing these cohorts of people in this way? And are you going to publish any research or something exciting like that, Glenn?
Yeah, so we'll report back to the trust at 1 year on outcomes of the 5 people who are in the pilot. And hopefully, if it's been useful, then they will add it to the way that this trust works is that there's $1,000 per calendar year for people to use on health, and so they can use it for our metabolic program if they choose to. Yeah, so that's how that's working. Everyone else just pays themselves. They're just self-paying customers.
And can I ask, how much does it cost for someone to enter into the metabolic program?
Yeah, interestingly, we started selling these programs, like I think it was something like $1,000 for a program, and people didn't buy a program because I think people are used to seeing a GP and then being referred. So now they'll just book an appointment with me. So half an hour is, I think, $185, and then I'll refer them on to the HIP or to the health coach or whatever the referral is that's needed. Yeah.
Great. Fantastic. I am looking forward to seeing this rolled out all over New Zealand. It's very similar. I put a course together a couple of years ago. I got a grant given to me, and I put a course, and I'm just listening to your course, and I'm like, this is all the stuff I covered: food, exercise, movement, psychological tools, obviously, as well, community connection. And it's, to me, it should be first line of treatment for depression, anxiety. So I think you're doing amazing stuff.
I hope I won't offend anyone, but SSRIs just don't work in mild to moderate depression, so why are we doing it? The answer is because it's quick and easy and no one criticizes us for it. But if we're being honest, and the Hippocratic Oath, first do no harm, we can't really say that we haven't read the studies that say they don't work. So we've really got to look for more effective treatments. And my logic here is that if exercise is 2.5 times more effective than SSRIs, and then if each of those other interventions was even close, you add all that up and you're 10 times more effective. You're looking at a pretty effective treatment, particularly if you provide the support and the coaching associated with it.
Yeah, absolutely. Yeah.
Sounds like I need to mirror that program for Pacifica communities, Glen?
I think so. And I think the other thing is it doesn't have to be all of those things, because just choosing the exercise and the food and the community, that's going to work. And I don't think you have to use daily essential nutrients. You could just use some B vitamins in the morning and some magnesium at night and some omega-3s. I think we can adapt it to the environment that we're working in.
I agree.
Mm.
Can I
I'm
just
always
ask?
amazed. Yeah.
Oh, sorry.
Carry on.
Just to go back a couple of steps, Glen, can you tell me about the functional testing that you do? Is that something like the Dutch test that you use, or something similar in terms of hormonal assays and serotonin levels and things? So, and gut biome is like a stool sample that you obtain or get sent to the lab. Is that what you're doing in terms of assessing neurotransmitters?
Yeah, I'll show you the test. I'll just
Is it an oat?
they're all examples of the functional medicine tests that that you can get through these functional labs. But you've just not the specific ones, but I'll show you. This is NutraScript, and I'll show you neurotransmitters. Don't if you haven't seen the cost of these tests, please don't fall over. But that screen, this is one here. So neurotransmitters extensive, it should say expensive. Retail price 417. And I'll just open that up for you. So testing serotonin, GABA, dopamine, noradrenaline, adrenaline, glutamate. Yeah, so that's an example of one of the neurotransmitter tests.
So that would look at things like fasting insulin as well, or
No,
not necessarily.
no.
Okay.
Wouldn't it be nice if you could just do one test for everything? But no, you'd have to. Yeah, there's a separate test for methylation cycles. There's a separate test for microbiome. There's a separate test for, all of these things. There's lots of options, but they're all expensive.
Okay, thank you.
So would this be useful for some clients who's got adrenal fatigue and chronic stress?
Yeah, there's a separate adrenal panel. So yeah, so we'll look at, but yeah, there's you can basically test everything that you want. But yeah, we could find an adrenal one. Yeah, so I don't usually use that one, but yeah, you'd find a adrenal fatigue panel as well. And yeah, all the hormone tests, oat tests. Yeah, there's lots and lots of options.
Okay.
I've done a few hundred of those stool tests and microbiome mapping when I used to work at Be Pure. So we spent a lot of time looking at gut health, and it's fascinating. So don't do so many of them now, but yeah, interesting stuff.
I I sort of say if someone gave me $1,000, I can guarantee that I could fix their irritable bowel syndrome, because I would do a IgG food panel which looks for 96 delayed hypersensitivity reactions, and I'd do a microbiome test, and I could almost guarantee that you know, you'd find the cause. So yeah.
Yeah, it's so interesting to do those tests. Unfortunately, they do cost quite a bit. Right, I think I've just got a chat message, and all good, all good. All right, thank you so much, Glenn. That was fantastic, and I love to hear what you are doing. I know that there's a lot of people out there, perhaps similar to me, that are working in different models or that are taking a really different approach to mental health and struggle a little bit with getting heard by other health professionals. So it's nice actually to find, other thing I wanted to ask you, it's nice to find your tribe, you know, the people who are doing these things and get it. So I was wondering if you wanted to just speak very briefly about whole New Zealand, because I think that's a really important way in sort of how people can support you or the work, or if people want to know more, where do they go, or if we want to collaborate, how does that work?
So Whole NZ is Karen Zinn is the main person there. Karen Zinn's a dietitian. She was one of the authors of What the Fat. She, through AUT, applied for a Health Research Council grant to look at the implementation science of carbohydrate restricted diets. So that was a $1.4 million grant over 3 years. So stage one was looking at the work that Lily Fraser has done in Turiki Medical Centre, and the work that Jala and I did at Topol Medical Centre around diabetes reversal. And that's been, those results have been written up at the moment. Stage two was rolling a program, and there was also a lot of interviews of people that had been part of the program, asking them what worked and what didn't. Stage two was rolling out, is this year, and it's rolling out in some interested general practices around the country. And then stage three will be trying to do a national rollout of it. So implementation science is looking at the way that you do it. You know, how does it work? You know, so that's what that's about. But Whole NZ is a website as well, which will hold the resources that you can refer people to, either for yourself to use in your practice, but also to refer people to. It holds the clinical papers and the resources, so that you know, you've got one place where high quality resources are available, and it's already pretty good, but it'll continue to get better over time. So if you're in a practice and you want to be supported to set up a diabetes program using carbohydrate restricted diets, then now's the time to put your hand up, because yeah, this is year two.
Yeah, yeah. I'd like to join the mental health one, Glenn. So let me know when that's been rolled out.
Yeah, and then, you know, cancer's the other really interesting one, where I think this integrative approach has a massive opportunity. Just very briefly, you know, there's two stages of cancer. The first one is the kind of adult cancer, and that's where radiotherapy and chemotherapy and surgery is just exceptionally good at treating. But then there's the second phase, which is the stem cell phase, where the stem cells are still cruising around looking for inflammation and injury. And that's the stage where you've got to heal inflammation and injury, and that's what integrative medicine is so good at, and we've got to introduce this second part where we add on to what the oncologists are doing so wonderfully well, but we add the second phase on where we prevent the cancer recurrence, which is where they don't pay as much attention. So I'm really excited about that opportunity of integrative medicine, and we're just sent around a questionnaire to our 80 to 100 people just today, auditing how they've gone on that program. So we'll hopefully be able to publish that at some stage soon.
Wow. Very cool. Great work.
Okay. Well, I might leave you all because I'm going to go and have my low carbohydrate dinner with
Highly
no
nutritious
snacks
and no seed
snacks
oil.
afterwards.
Fantastic. Thank you so much, Glen.
Thank you.
Thank you, Helen. Thank you,
Appreciate it.
everyone.
Thanks, Glen. Thanks, Helen.
Thanks, Glen.
Yeah, I hope it wasn't too simple, because I know you guys are experts in this area, but yeah, thank you for